the lack of estrogen, the doctor can prescribe you some vaginal estrogen. If it's just vaginal dryness and vaginal atrophy, that's sort of a more technical term for it. But then the GP can look again about giving you overall HRT. Will have a massive impact on and boost your quality of life, and it's it's suitable for most people. But just for the genital and the vaginal dryness, it's vaginal estrogen, and there are also some over-the-counter lubricants that you can buy as well. If you wanted to write into the Live Better with Menopause forum, I can actually go into more specifics about that as well, because there are some that I would recommend and some that I probably wouldn't so much. So I just think it's just important to know. If you don't use the right vaginal moisturisers, that can actually affect the pH balance in your vagina and actually make the condition a lot worse. And also just think about clothing that you're wearing, if you're using any soaps, which I don't advocate to wash down below at all, just with water. So there's lots of things that you can do just to help that, but it's very important you discuss it with your GP. But there is definitely help there for you. If it's vaginal atrophy because of the menopause, the GP can prescribe you some vaginal estrogen, and then it's about getting some vaginal moisturisers as well, and maybe some systemic HRT. Is that okay?
Thank you very much. Thanks, Dan. Another question is about weight gain. So I work out regularly, I eat healthily, and the weight doesn't come off. What can I do?
Oh, I hear this all the time. It's a really difficult situation, because during the menopause, with our fluctuations of hormones, the estrogen, the progesterone, the estrogen predominantly, but we start to store fat around our midriff. It's called the middle age spread for a reason. It's not pleasant, and it makes us a bit more sort of like, instead of being more curvaceous, it makes us a bit more up and down in appearance, and we store fat all around our belly. We're all individuals, and I think the most important thing is to think that it is a part of the menopause. It doesn't affect everybody, but it does affect some people. So it's a case of looking at your diet, because you might think that, again, that it's something that you're eating all the right foods, but actually when you speak to somebody that truly understands about nutrition and health, that actually there are ways that you actually are eating the wrong foods. So that's just one point. Hormone replacement therapy doesn't make you gain weight. It's what they call neutral. Some people lose weight, some people stay the same, some people put weight on. But menopause is something where you just generally put weight on, and that affects most women. Most women find that they start to store fat around the midriff. There's not a lot I can do about that, other than we just said about exercise, eating healthily, and being aware that there might be other risk factors and other things that you can do to actually help with the weight, such as exercise, and certainly getting professional dietary advice.
Thank you. And you mentioned HRT. We will come shortly to treatment and HRT and go into a bit more detail on that. Just on symptoms, so we've got another question. What supplements or vitamins should we be taking, especially for thinning hair? So thinning hair is a symptom.
Yeah, it's all to do with the lack of estrogen. It affects the collagen, which makes our nails brittle and our hair dry and brittle as well. So again, this is all part of menopause. Particularly if your hair is in a bit of a bad state, it might be worth getting some professional advice as well. There are people out there that specialise in hair analysis, and they can certainly give you advice about that itself, because it's very common. Again, you need to talk to the GP, because it could be that there are other health conditions that's causing this. But as far as menopause is concerned, I think if you just stick with some standard multivitamin and mineral supplements, I'm certainly not a herbal practitioner, and I can't give you advice regarding herbs per se. If you're going to take herbal medicines, then I do advocate that you speak to a qualified medical herbal practitioner, and they'll tell you exactly what you need to do. There'll also be other information on Live Better with Menopause for different things to do with herbal medications and things that will help as well.
Perfect, thank you. So from some of the physical symptoms to some of the emotional and mental symptoms as well. So we have a couple of questions on anxiety. So I'm just going to read them out. They come from a couple of different angles. So one is, I've been in the menopause for a couple of years. I started having tremendous anxiety at the end of 2019. I had counselling, which helped a lot. However, I still have strange anxious thoughts at random times. They often come out of the blue. I now think I know I'm not going completely mad, but is this something that happens and will it stop? My current response is to tell the thoughts to go away. A doctor friend described it as brain cells going pop. HRT has helped with the usual menopause symptoms. So that's one of the questions on anxiety. And in terms of that's really, is it normal? Does it happen and will it stop? And we have another question, which is around, I've started taking antidepressants for it. Would HRT be a better option? So a couple of angles there.
Yeah, so the first question then really is about anxiety. You're taking hormone replacement therapy because during the menopause, when we could become deficient in estrogen, because I do like to class this as an estrogen deficiency, and that's really what it is. So all these symptoms have been driven by the physiological changes going on in the body that are reducing our estrogen levels. So it's estrogen deficiency, it's what we're really talking about. So with the estrogen deficiency, HRT should be helping with the symptoms, and anxiety is a very common symptom. So all I would suggest really is, first of all, maybe go and see a GP to discuss your HRT review. But the other thing, we can have anxiety for other reasons as well. So again, thinking about counselling again, or, certainly talking to friends and family to figure out what the actual reasons are that you are feeling anxious. And are there other fundamental things happening in your life with work and stress and COVID and all these various things that are just exacerbating all of our anxieties? So I wouldn't worry, and I say worry too much about it, but I think you need to talk to your doctor about it and try and get on top of the HRT. And if the HRT has been addressed, but you still have this anxiety, then you need to view this in a bit of a wider field, to think, okay, well, what else is happening with my life? And then do a bit of self-analysis and self-reflection, really. And what was the other question again?
The other question was, I've just started taking antidepressants for anxiety. Would HRT be a better option?
Obviously, if you just purely have anxiety and depression, then obviously antidepressants can be beneficial for many people. But if we're talking about this during the menopausal stage, and there's no fundamental reason why you're feeling anxious or depressed for no other reason, then menopause is something that drives these feelings. The NICE guidelines are quite clear that low mood in menopause, HRT should be the first line treatment, not antidepressants. Unfortunately, I do hear many women saying to me all the time that they've been prescribed antidepressants when they're clearly saying to the doctors, I'm actually not depressed. I don't want a prescription for antidepressants. I hear this so many times, but it's actually written in the NICE guidelines, which every health practitioner should be following, or certainly using them as a guide to safe prescribing and safe management of particular health conditions. So yes, HRT is first line treatment for low mood in menopause.
Thank you. So if just to reiterate for those who've joined, if you want to ask any questions, just pop them in the Q&A box. It's at the bottom of the screen where with the two speech bubbles, and if you just type them there, I'm keeping an eye and we'll get them answered for you during this course. We're about halfway through here. So Dan, I wonder if we can go on to maybe talking a bit about HRT. And we've had one question, which maybe is a good intro one. Can you please explain the types of HRT, which is the safest to use? Brackets, my doctor is useless. But maybe we could start talking about it in that way, and then we can come on to a few questions around who can and can't take it, what the risks and benefits are.
Okay, the HRT, there are the different types of HRT, and it does get quite confusing, but the safest types of ways to receive estrogen is when it's absorbed through the skin. So that's either in a patch or a gel, because when you take a tablet version of estrogen, the liver enzymes come into play and they affect the medication, the blood, various things like this. So therefore it's better to have estrogen that's taken through the skin, because the liver isn't activated, it doesn't produce enzymes, it's called first pass metabolism, and so therefore the estrogen is absorbed straight into the bloodstream from the skin. So estrogen in a patch or a gel is the safest way to receive that. So patches and gels are probably the number one that I would always vote for. The progesterone, you can have that in quite a few different ways. You can have that in tablet form, in patch form, or a very good source of progesterone is in the intrauterine device, the Mirena coils. The coils that people have, they slow release of progesterone and they last for 5 years. So that's contraception, and it's HRT as well. So it's a really good source. I do advocate the coil, but also there are different types of progesterones, and the progesterone I generally find is a bit of a problem area. So trying to get the progesterone element right. Tablet versions of HRT, you can take tablets of estrogen and progesterone as in like in one go. That carries a few more risk factors associated with our health. Certain things like if you have migraine with aura, you wouldn't want to take that in a tablet form. A normal standard migraine is fine, but migraine with aura, definitely you need to be thinking about the way that you're using your HRT. And then there's testosterone as well, which is a very important hormone. We produce an awful lot of testosterone in our lives, and we can become deficient in testosterone just as we can with estrogen. And so it's important that testosterone is incorporated into that as well, and not to forget it. It's not something just for men. It's something that women do need to take. Some women do need to take it. And it's just to be aware that's a question to talk to your GP about.
Thank you. And how long can you take HRT? It's a question from one of the attendees. How long can you take it, and what age should you finish taking it?
Right, this is quite interesting. There isn't any limit on it. That used to be quite strict. But I'll just bear with me a moment, because what it is that the old guidelines are saying that you take any prescribed medication for as long as the benefits outweigh the risks, and you take things at the lowest dose. However, with estrogen, many women find that they do need, particularly younger women, they do need a lot more estrogen. And then the older you get, you just take less. So I'm quite happy to prescribe to women that've got no underlying health concerns. You can take it for many, many years. You can take it up into your 70s. I know people in their 80s that are taking HRT. So it's not something that you necessarily have to take for a couple of years. If you did just want to take it for a short term, it will give you huge benefits, certainly with symptom control, but also cardiovascular and a lot of the protections of the bone and things like this. Because as soon as you stop, those factors won't be as effective anymore. But the thing is that you don't have to stop taking it after just a couple of years. You can take it long term as long as your risk factors are low and you're being monitored by your GP. Okay.
Somebody on the call has asked, they're currently taking HRT through Cleofern. I may be saying that wrong. Cleofern.
Yeah, Cleofern.
But finding that my menopause symptoms are progressing, what alternatives can I consider? And obviously recognize you can't necessarily give specific advice, but what should someone do if their symptoms are progressing despite being on HRT?
Then you need a HRT review with your GP, and you need to discuss your symptoms. So what I would suggest you do before you get an appointment with your GP is to write down all of your symptoms that you're having and mark them out of 10. 0 being no symptoms at all, and 10 being horrific, and mark them out of 10. And there are quite a few different things. There's a very good screening tool that I use, a lot of health professionals use. It's called the Green Climateric Score, and it's a really good screening tool that we use in menopause that you just tick off, and it's a mark out of 3. You just tick off depending how severe your symptoms are. And if they're severe symptoms, then it's indicating, particularly if you've got lots of severe symptoms. If I see people who've got very few severe symptoms, I think, well, they're being adequately managed. So the Green Climateric Score. But if you don't want to do that, just write down your symptoms and mark them out of 10 and take it to see your GP. And then you can say, I'm taking this HRT. It doesn't seem to be working. And the question is why. Sometimes you need it reviewing. You might need it increasing, or you just might need a different route. You might need your bloods checking for your estrogen levels as well.
Thank you. I've got a few questions on safety and risks of HRT. So More generally, is HRT safe, and where do the risks lie? And a couple of questions are around, if there's a lot in the press always about cancer and HRT, so maybe you could just comment on that. Is it appropriate for someone living with cancer or with cancer in the family? And also the age. So are there any risks if you start taking HRT patches at a younger age, say, than under 50 or under 45?
Well, first of all, I'll answer that one. No, in fact, if you're developing menopausal symptoms at a younger age, it's vitally important that you're managed correctly by your GP. Your GP, particularly if you're under the age of 40, your GP would refer you off to a specialist clinic. You'd have lots of bloods checking to find out. There's a condition called Premature Ovarian Insufficiency. And it affects about 1 in 100 women, so it's quite prevalent there, and women need to be aware if they are having symptoms of menopause under the age of 30, and particularly issues around fertility as well. They must get followed up with their GP. It's very important, because the lack of estrogen potentially with younger women can have a massive impact on every aspect of their life. It will increase their risks of heart disease, increase their risks of osteoporosis. So all it would mean that these women will be managed correctly. They may be put on the contraceptive pill, because that would be estrogen and progesterone. They may be started on HRT, or that might not be suitable for them. But whoever they're referred to would actually discuss all of that with them, and they'll get lots of follow-up with that. So I just wanted to mention that. Premature ovarian insufficiency. So that's like an early menopause under the age of 40. Desperately need to get sorted, and investigations. It might not be menopause, but you need to find out if it's not menopause, what is it, and get the right treatment for it. And I've forgotten the other question.
That's all right. Sorry, I'll ask you 2 questions at once. It was more about the again, safety of HRT, but particularly when living with cancer, or you have cancer running in your family. And there's a lot of talk about this. What should people bear in mind?
Okay, this is something you need to have a really good talk to the doctor about, because I often see people that say that they've got a family history of cancer, they can't have it, and that might be that their nan died of breast cancer age 77 or something like that, and it's not really that relevant. I don't mean to be putting people down, but it's the risk factors that are very important. So if we talk from one extreme to another, so if somebody, a family member has died at an older age, remember, cancer is more prevalent the older we get. We've got more risks of getting cancer the older we are. So our chance of getting cancer in our 70s, 80s, 90s is far higher than somebody in their 30s. So it's age related. So if somebody of an older age develops any form of hormonal cancer, it's not really that relevant to your symptoms at that time and your treatment at that time. If you've got a younger family, so that would be like a mum or a sister or anything like that was under the age of 40, then that's more relevant, and particularly if more than one members of the family have been diagnosed with a hormone-related cancer. There are some genetic testing that can be done for that, but it's to do with age. So if a family member really is sort of like, over 40s, then it could just be that you would be absolutely fine to have HRT, but it's a discussion that you'd have with the health practitioner that was going to be looking into your menopause, and they might be referring you to some menopause specialists to discuss it. You might need some genetic testing as well. But even with people that have had cancer, they can still have HRT. It's not a complete no-no. For most women, it probably would be, and it's a decision that you have to make personally with the health practitioners, and it's all about a discussion between quality of life versus risks. Again, it's one of those hard things, because just because you've had cancer once, it doesn't necessarily mean you're going to get it again, but it really is a quandary, and it's something that needs a lot of discussion and a lot of thought practices. HRT is really quite safe for the majority of women, and the majority of women will take HRT quite happily and have absolutely no effects whatsoever. So unfortunately, the press sometimes they publicise this as this terrible thing. And obviously anybody that dies with any form of medication, it's not good at all, but sometimes that's just the way things are, and we may not have been able to prevent it. It might be because of the HRT, it might be genetic, it might be because you're overweight. Being overweight gives you a huge risk factor associated with breast cancer, far more than HRT would. So again, it's looking at the risk factors. There's so much in the press that's so negative about HRT, but I'm very much at looking at the benefits of it, but weighing up what's suitable for each person. So I think the most important thing about menopause care is it has to be individualised. And that's why it's important to actually see people that are experienced in menopause care, because it's tweaking treatments and management that are suitable for you and listening to you and working out what your main worries are, your main concerns are, and addressing them. Because there's no point prescribing something to somebody that are walking out the door and they're not happy, or they're just really frightened. And I do speak to a lot of women that have actually been in that situation, that they've had a 10-minute consultation with their GP. They've come out the door with a prescription and they don't know what it is. It hasn't been explained to them. So it's just a lot. It's about education and support. So as soon as women understand that there are risks associated with HRT, but they're actually quite small, and there are huge benefits of taking HRT. So I think it's just putting it all in perspective on what suits your needs and what's your quality of life without going through the menopause. Suicide is incredibly high in menopausal women. It peaks at women in their early 50s. And this isn't really highlighted and this isn't discussed. But why are women committing suicide in their 50s? And I know that a lot of it is related to menopause. So, we mustn't underestimate the absolute impact that menopause has on every aspect of your quality of life. So is that okay?
Yeah, thank you for being so clear about that. And actually, I think we've got a couple of minutes left. There's a few final questions about the symptoms and side effects. And to your point, it really does impact life, and the side effects can be really hard to live with. And that's nothing to underestimate there. The couple of questions, I'm sorry if we don't get to all the questions that have been asked. You can ask Diane any more questions on our forum at any time. So I'm going to pop the URL in the chat and in the screen, so you can find her there and you can ask any more detailed questions. But I wonder if we can just maybe answer 2 or 3 more symptom questions to finish this off. One is from someone who's joining us from our cancer community. And so many of our members, she says, who have been through cancer treatment then have to take hormone-based medications like tamoxifen. And as one example, these medications can produce menopausal effects, which are very hard to live with. Given that kind of context, do you have any tips for things like hot flushes, sleep problems, mood swings, to name just a few? Now, I know that each of those probably has its own webinar just to address, but and she says, unfortunately, often we are finding we just have to live with it, but not finding much relief for the symptoms. So anything for somebody living with cancer? And
yeah, I mean, if you're taking tamoxifen, you can have vaginal estrogen, and that is something you need to talk to your GP about. So if you've got any vaginal dryness, soreness, itch, frequent urinary tract symptoms, painful sex, anything like that, and you know that you just vaginally feels dry, with tamoxifen you can take some vaginal estrogen. It's not contraindicated, but other medications are. So you can't have systemic HRT. It would be something you need to talk to your gynecologist, your cancer specialist and your GP about. But things medication-wise that could help. There are some medications the GP can prescribe that are not hormone-related that would help with some of your symptoms, but it's a little bit ad hoc. They're not as good as HRT, but HRT for majority of these women, it will not be an option. Things like mindfulness, yoga, cognitive behavioural therapy, meditation, I can't rate them enough. I think they are amazing. And I think that's something that we really need to be pushing in the menopause community as well, because it's a case that, you can take HRT and you can do this as well. Or if you can't take HRT for some reason at all, then exercise, positive mental attitude, meditation, mindfulness, yoga, I think are absolutely amazing. So don't underestimate. You might think it's nothing, but actually the impact of these therapies is truly amazing. So yeah.
Thank you. And I'm going to ask you one more symptom question, just because it was asked a few minutes ago, and I said that we'd answer it live. We've had 2 questions on painful and aching knees and ankles and puffy swelling ankles and feet. And those 2 people have asked this. One says particularly bad in the weeks before dwindling period, not overweight and walk each day. Anything someone can do. Can imagine.
Well, I know I sound like it's a broken record, but this is to do with estrogen and hormone fluctuations. And it's a case that your body, your hormones are literally just doing this, but predominantly on the downward spiral, and it's to do with hormone fluctuations that are causing these symptoms. Aching joints in particular is a very common symptom of lack of estrogen, and by replacing estrogen you can improve those symptoms quite dramatically, and you're doing the right things as far as exercise is concerned. I mean, the only other thing I'd mention the fact that if you're predominantly getting pains and aches and things, everything must always be discussed with your GP first. That goes without saying. With everything I've said this evening, your GP needs to be informed and aware of all your health conditions. That's the most important thing. So if you're worried about this, you must go and discuss it with the GP.
Okay, thank you so much, Diane. I've got more questions, but I'm really conscious of time, so we'll wrap it up here. But if you do have any more questions, you can ask Diane on our forum. So I've put the URL for our forum in the chat. So if you just see at the bottom of the screen where the chat function is, some of you have been talking on it already, but you can visit us at community.livebetterwith.com /menopause/discussions. So it's just there if you want to copy paste it, and you'll find Diane there, and you can ask her. There were a couple of questions we didn't get to, or anything else that comes into your mind that you'd like to know about. But we will end it then. Diane, thank you so much. That was such a rich 30 minutes. I think we got to so many topics. Maybe we can do that again in the future and cover even more.
That'd be really good. So yeah, look at all my information on Live Better with Menopause. All my links are there, all my personal information's there. Ask any questions, and also there's an area which you can ask a private question as well. So that would just be between the 2 of us. But like I said, what I think is really important is that it's fine to talk to people like me about these problems, but you must discuss it with your doctor as well.
Thank you so much. So Diane and everybody joining, have a lovely weekend, and thank you again.
Thank you very much. Thanks. Bye-bye.
Bye-bye.